Good afternoon, Durham. I'm Jenkins, Director of the Durham County Department of Public Health. This week, we opened vaccination Group 5, which means all people ages 16 and older are now eligible to be vaccinated. Now that vaccinations are open to everyone, we're getting more questions about scheduling, while also observing more confusion around vaccine information. Today, I will address your scheduling questions as well as dispel some common COVID vaccine concerns. Please remember that at this time, our scheduling list continues to be our only scheduling method. This is the only way to sign up for vaccines here at our building or at the recently opened vaccination site at 415 Hoover Road, formerly known as Wheels Fun Park. You can sign up for the scheduling list at the site shown on screen. There is more good news. Now, with vaccine supplies slightly increased and more options than ever before for vaccination locations, we're able to move through this list quicker than ever before. This week, some of you signed up for our list and were contacted the very same day. We can't promise it will always be this way or this quick, but we will keep working to make it easy. Signing up is fast. There's no login process required. Just add your name and information and we'll call you to do the rest. You can sign up for this list if you're 16 years old or older. Because Pfizer is the only vaccine approved for people under 18 at this time, we'll be sure to schedule these young people to receive a Pfizer vaccine when they arrive. If you are under 18, be sure to have your parent or guardian sign a consent form before you arrive. If you can't get this form signed in advance, it will be important for a parent or guardian to come with you. Our scheduler will give you more information about this when you schedule your appointment. Speaking of scheduling lists, please remember that this list is used to schedule first dose only. If you receive your first dose with us, we will schedule your second dose appointment while you are here. If you receive your first dose somewhere else, you will need to return to that location for your second dose. This is in accordance with state guidance, as we only expect to receive enough second dose vaccines for the people who received their first shot with us. Now that everyone is eligible for vaccines, there's more information being spread about vaccines than ever before, and it can be hard to tell what is true from what's not. Let's address 3 areas of confusion and misinformation we've seen the most and provide very simple answers. Concern number 1, can COVID-19 vaccines give you COVID or cause you to test positive? The answer is no. There is no live virus in any of the vaccines, and they will not cause a positive test at any point following the vaccine. The way that the vaccines are structured, it is impossible for any of them to give you COVID-19. Concern number 2, can a COVID vaccine alter your DNA? The answer to this is also no. COVID vaccines never enter the part of your body where your DNA is stored, meaning these vaccines do not interact with your DNA in any way and cannot change it. Concern number 3, and perhaps one of the most frightening rumors being shared today, is that COVID vaccines are causing deaths. This rumor is usually based on a misinterpretation of information shared in a vaccine monitoring system called VAERS, shown on screen. I encourage you to visit the CDC or VAERS website to learn more about how this system works. But for now, I'll keep my answers simple. The CDC and FDA review all reports of deaths after COVID vaccines, and to date, there has been no evidence that a COVID vaccine has caused patient deaths. Remember, something happening after vaccines, even weeks or months later, does not necessarily mean that the vaccine caused this thing to happen. We are thrilled that finally all people are eligible to be vaccinated. We are excited that we've begun seeing younger and more diverse patients in our clinic, and we look forward to seeing not only more young people, but people of all ages. Our doors are open to you all. Our scheduling is faster than ever before, and we are here to answer your questions. Sign up for our scheduling list, visit our website and social media for answers to your questions, and we hope to see you soon. We are one step closer to getting vaccines to everyone. We can do this, Durham.